Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Tuesday. It's March 10th. Excuse me. It is 5 p.m. Okay, so yesterday we started talking about the sunshine vitamin, vitamin D. Now, there was too much to cover in one talk, so let's continue a little bit more. Okay, so what are the symptoms of vitamin D deficiency? Okay, there's a great body of evidence that shows that people with vitamin D deficiency are at increased risk of developing health complications, including cardiovascular disease, cancer, and immune disorders. Researchers suggest anyone with the following symptoms should be tested for vitamin D levels. Okay? If you have weakness, chronic fatigue, depression, trouble sleeping, anxiety, weak or broken bones, inflammation, and weakened immune system. Okay, you should also be tested if you have any of the following conditions: osteoporosis, heart disease, hypertension, cancer, autoimmune diseases, depression, insomnia, arthritis, diabetes, the list goes on, asthma, multiple sclerosis, chronic pain, psoriasis, fibromyalgia, and autism. Now, there are many other reasons to get tested, but clearly you can see this vitamin has huge role in many body systems. This is one you really need to check on. And as I said, about 90% of Americans are vitamin D deficient. That's a huge number, okay? So what testing should you have? Hello, Slobodanka. Hello, Rhonda. Okay, so what testing should you have? Even though the active form of vitamin D in the body is calcitriol, the best estimates of vitamin D status in your body are provided by measuring 25-hydroxy vitamin D. So you'll see that on a blood test as 25-OH, that's hydroxy vitamin D. Now, the compound lasts in the body for about 3 weeks, and it reflects the availability of the substance that is needed to make the calcitriol. Okay, so if you don't have the precursor, you can't make the active form. Okay, so that is the best test to get. Now, what are good and bad numbers of 25-hydroxy D? Ideally, you want to be over 50. Okay, I don't mean your age, I mean your vitamin D level. Okay, I say even higher. I say push for over 80 because then you're really doing really good for your body. I think my last test was 86. Just saying. If you are 30 to 50, you need more work. You need more time in the sun, or you need to supplement, obviously. You need to add vitamin D foods. Less than 30 means you are very deficient. You need to take immediate action, and you need to do it, like I said, immediately, because you're at risk, unfortunately, for getting something to happen. It's only a matter of time. And I'm not trying to be a doomsday type person, but this is something you can fix pretty quickly and pretty easily. So there's no reason to stay in this deficient state. So let's talk about supplements for a second, okay? Because there are a gazillion out there. There are 2 types of vitamin D supplement. There's vitamin D2, which is ergocalciferol, and there's vitamin D3, which is cholecalciferol. The precursor to vitamin D is found in plant and animal products, but the animal-derived vitamin D3 are thought to be more absorbable. Vitamin D2 is created by irradiating yeast and mold to create vitamin D3, but our body naturally makes vitamin D3, so this is the form that is preferred. Okay, unfortunately, most vitamin D fortified foods are fortified with vitamin D2. Okay, hi Yuki, hi Kate. Okay, so if they're fortified with vitamin D2, that's neither absorbable nor convertible by the body, so it's a waste of time. Okay, so you really need to be careful saying, will I drink vitamin D fortified milk? It's probably not acceptable unless it says that it's vitamin D fortified with cholecalciferol vitamin D. You're not getting what you think you're getting, okay? Vitamin D3 is believed to convert up to 500 times faster than D2 and is estimated 4 times more effective. More bang for your buck. Go for vitamin D3. Okay, now the recommended daily dose of vitamin D is 600 international units, but many doctors will say take up to 1,000 international units daily for a short time. Now, I'm going to tell you, I am not your doctor, so you need to discuss this with your healthcare provider. What I'm going to tell you is what I do. That doesn't mean that's right for you, but I wanted my vitamin D levels up. I have a very strong family history of breast cancer, and I wanted to, every person I know that has breast cancer has vitamin D levels under 30. Okay, I told you it's not causative, but it is definitely linked. So this is something that I wanted to make sure that I was not in that situation. So my vitamin D level is over 80, and that is where it will stay. So since most of us are deficient, we need much more, in my opinion, okay, to catch up. Most holistic doctors are recommending 5,000 to 10,000 international units, especially if you have underlying conditions. Now, as this is a fat-soluble vitamin and doesn't get flushed down the toilet if you take too much, kind of like vitamin C, which is okay. You should be taking a lot of that right now. You need to use a little caution. The best way to absorb this is to make sure you're taking your vitamin D with a fatty meal. Okay, some medications will interfere with his absorption, such as antacids, diuretics, and some cholesterol and heart medications. Other nutrients that help to increase your vitamin D absorption include vitamin E, vitamin K, specifically vitamin K2, vitamin A. Those are all your fat-soluble vitamins. They all get absorbed kind of together, right? Magnesium and zinc. Okay, so lastly, vitamin D is stored in fat. So overweight people are often vitamin D deficient in the blood because a lot of that vitamin D is stored in the fat and is not useful. It's not being used by the body. So understand another quick just tip that I have. Usually when you buy a bottle of vitamin D, it comes however many capsules, and it's sold 5,000 international units or 10, let's say. For the same price. Buy the 10,000 one and take it every other day. If it's fat soluble, your body will store it and use it as it needs. So instead of taking 5,000 every day, take 10,000 every other day and save yourself on, half as many bottles of the supplement. Again, this is my recommendation. This is what I do. I am not your doctor. Please discuss this with your doctor. And if there is any contraindications for you taking that much, I think the benefits outweigh most of the risks. So that's why you need to get tested. You need to see where your vitamin D levels are at, and you need to try and get them at least over 50. Google it, look it up, and see, and do your own research, do your own studying to determine if you believe me. But this is where the science is saying. So hopefully this is helping you, helping a lot of people out there decrease their risk of lots of diseases. All right. Hope you guys are having an awesome day. It just poured here in South Florida about an hour ago. Now it's sunny and gorgeous. I mean, who knows? So hope it's nice where you are. And I will see you again tomorrow for another Live in 5.